Thank you, everyone, for attending today's Lunch and Learn on the end of financial year in Gentu. My name is Sean Nolan, and I am the Customer Education Specialist here at Genie Solutions, a Magentus company. I'd like to begin by acknowledging the traditional custodians of the land in which we stand. For me in Brisbane, this is the Turrbal and the Yagara peoples. I would also like to pay my respects to elders past, present, and emerging. Today, we are covering the end of financial year, which covers parts of Gentu that you should run to ensure your reporting is as accurate as possible for the end of financial year. We will start with the end of financial year checklist that we recommend practices run through. Next, we will look at the missing invoices report to make sure you aren't missing any unbilled appointments or procedures in your reports. There are other steps and shortcuts we will look at to ensure your reports are showing the most accurate reflection of your practice. Following this, we deep dive into the reports you may need to run for the end of financial year. We will then have a talk about some items that practices need to do to ensure they start their new financial year successfully. To finish the presentation today, I will show you a sneak peek into e-prescribing and what is required for your practice in order to use e-prescribing. The last few minutes will be a live questions and answers, where we will answer as many questions as we can. There is a Q&A box in the Zoom window, so I encourage you to type any questions you have during the presentation into this box. I will be joined by Alexi, the National Customer Training Manager. If we do miss your question during the questions and answers, we encourage you to go to our website and there's the web form you can fill out to ask your question. I'd like to start by providing the end of financial year checklist that trainers from our company often discuss with practices. We are going to cover each of these as part of today's presentation and a bit more. There are some joining today's presentation that have recently moved from our Genie desktop program, and they have specific workflows they are used to, so I will address these as well. Let's start with what we recommend that you do when possible. It's worth checking the deposits taken listed in the deposits report. There might be deposits that need to be refunded or applied to an invoice. The unpaid invoices report is strongly recommended, as you may have invoices that actually have been paid, but you haven't receipted them. In the claims control screen, you should handle any exceptions you can, as you might find there are simple resubmissions to be paid. For those of you who were on Genie before, you would be aware that you had to receipt your bulk bill, DVA, and Eclipse claims. In Gentu, these are automatically receipted for you. There's also no need to run a check integrity report in Gentu. Before the 1st of July, we recommend running the missing invoices report, as there may be appointments and procedures not invoiced. For those from Genie now on Gentu, you do not need to keep up to date with retrieving Medicare, DVA, and Eclipse receipts, unlike our recommendation for Genie. On the 1st of July, the financial report is normally generated, and the unpaid invoices reports. Practices often give these to whoever looks after your financial reporting. If you need to update your private fees, this is sometimes the best time to do it. For those of you who have come from Genie or another software package, you may be aware there are monthly fee schedule updates for Medicare, DVA, and some health funds. You don't need to do this as part of Gentu. We handle those fee schedule updates for you for Medicare, DVA, and health funds. We are going to start by looking at the missing invoices report. This report should be run at minimum at the end of the week. It shows you all appointments and procedures that have not been invoiced. And one thing with any reports in Gentu, if you're ever reporting on invoiced amount, these will not show in those reports because you have not invoiced these appointments or procedures. To view this report, we click on the Reports button on the left-hand side. Next, we click the Missing Invoices button at the bottom. We can filter this report by provider choose a specific date range or a preset date range. This displays all appointments and procedures not invoiced. It defaults to sorting by date, but you can sort by other columns if you need to, including the appointment type. If you sort by appointment type, you can safely tick Not Required for any appointments that don't need to be invoiced, such as a post-op appointment. This will remove it from this list. To investigate an appointment that we wish to look further into, we click once on the date field for it. This takes us to the appointment, so you can investigate why it has not been invoiced. The next item you should investigate are any errors or exceptions for bulk bill, DVA, or Eclipse claims, as these are often sources of missing invoices and receipts, and as a result may not show in your financial reports. To access these claims, in the report section, you need to go to the claims control part. I don't have access to real exceptions, so I can only show you a screenshot of where you need to go. In the claims control, you can filter by a specific provider as well as a time period. If you're investigating unpaid invoices, you should ensure you have exceptions and in progress ticked, so this will display all claims that have not been receipted. Once you have the list of eligible claims, you can click on a claim to investigate it further. Any eligible exceptions will appear, and these can be actioned to resolve the claim and potentially recoup unpaid money. Remember, Gentu will automatically receive claims that have been paid by an electronic remittance advice, so you only need to work through exceptions or claims that have a substantial amount of time since sending without a remittance advice being issued. The deposits report lists all patients who have paid you money that has not been allocated to an invoice. Typically, this is a pre-surgery deposit. To access the deposits report, we click the Deposits Report button from the Reports section. This lists all deposits that have not been allocated to an invoice. You can click the arrow next to a deposit to expand it and to see further information. If you are running any reports that use the receipted amount, these deposits should be allocated to an invoice if possible to ensure that these figures are accurate. The Unresolved Invoices report displays all invoices that have not been paid. If you're running any reports on receipt date, just like the deposit report, you should ensure that you have receipted as much as you can before running any financial reports on receipt date. To run this report, we click the Unresolved Invoices report from the Report section. This can be filtered by a specific provider, a specific location, and to show you debts as of a certain date. So if it's past the 1st of July and you need to report on the 1st of July, you can change that to be the 1st of July. It shows you totals and then accounts that are less than 30 days, 30 days, 60 days, 90 days, and the total owing. Individual invoices are displayed underneath. You can click on an invoice to see more details of the invoice. From here, you can reprint the invoice, email the invoice, or receipt the invoice from this window. The financial report is your main financial report. It can be given to your accountant as a means of reporting on your practice. To open this report, we click Financial Report in the Reports window. This report can be filtered by a specific provider if required, a specific site, and a custom time range chosen, or you can choose a preset from this list. This shows you the data. You have the total amount invoiced, total GST invoiced, total receipted, and total GST receipted, how much was adjusted, any GST on the adjustments, and the balance, which is the invoiced amount minus the receipted amount. Each individual invoice for the time period is listed underneath. The arrow can be clicked to view more details of the invoice. The referral report is used to find out who your best referrer is. Now, who your best referrer is might be based on how many times that person has referred to your practice, how much money they brought into your practice, or where this referral was located. To run the referrals report, we go in our report section and we click on the referral report button. This report can be filtered by provider, by site or service, and by specific referral. We can choose a time period. I'm going to choose this financial year. This will display a report by income generated. It can be changed to number of referrals or the location of these referrals. Let's look at income generated. Clicking one referrers column will filter to that one referrer at the bottom. You can also see how many new patients were brought in from that referrer at the bottom in the new patient column. It can be exported to a spreadsheet or it can be printed out. The item report will show you how many times a specific item has been generated, how many times it's been invoiced for a time period. Why the item report is such a good report is because you might have a practitioner who wants to know how many new patients have come in. This could be done by how many times a new patient consult item number has been invoiced. You may have based on how many times has a certain procedure been performed. A procedure might have a specific item number as well. Item report is a great report if you ever need to look at anything based on the item number. To run the item report, in our report section, we click on the item report button. Here, this can be filtered by provider to only show certain locations, only show certain items. I'm going to choose all and choose this financial year. On the right, you can see each item that was invoiced. Moving the mouse over the item shows how much a patient paid versus an organization. A final report is listed below. This report can be exported to a spreadsheet or printed out. That summarizes the main reports you should consider running as part of the end of financial year in Gen2. Let us have a look at items you may wish to consider as part of the new financial year. These are updating your fees, utilizing the appointment book wrap-up function, and communicating with your patients in bulk. So the first item was as part of the new financial year or at any time of the year, you may need to increase your private fees. To do this, we go to our settings. We click Billing Items. We search for the item number we wish to change, for example, 104, and we choose it in the list. Here on the right, we change this to be our new fee, and then we click Save. If you use custom fees, you can click the drop-down menu and change the fee here as well. If you wanted to add your own custom fee schedule, well, we go back to our settings. Sorry, apologies. If you have any non-MBS item numbers, you can change the fee here as well at the bottom. If you wanted to add your own custom fee schedule, for instance, Howard Pensioner in that list, we go back to our settings. From here, in the fee schedules, we click Add. We give this new fee schedule a name, for example, Public, and we choose a rounding dollar amount. You will need to set a base rate for all the items. So all items, when you add a new custom fee schedule, they will have the same rate applied to it. Once you have that same rate applied to the items, you then go back to each individual item and you change the fee per item. So in this example, I'm going to round to the nearest cent. I'm going to set this to be $0 above the MBS rate or the Medicare schedule rate. I then click Save. What happens then is when I look up any item number as part of the custom fee schedule, I could choose Public, and for my public patients, I can put in how much I'm invoicing when I choose this fee rate. A function that is not often used is the appointment wrap-up, which is how your provider can communicate to admin staff about the items to charge and post-consultation actions. This is useful if, for instance, the doctor's in the consult room and does not want to leave the consult room to communicate a message to you. It can also be used for inpatient consultations where they might be put in as an appointment in the appointment diary. This means that your provider can, from the theatre room or the inpatient area, choose a wrap-up, and you know what item number to invoice for this inpatient appointment. So to send a wrap-up, we first open the patient's record. The provider will click the wrap-up button at the top right. A list of items will appear. If the item is not in the list, you can search for it, and it will remember for next time. You can also remove an item from the list by clicking the trash can icon next to the item number. So your provider should tick the item they wish to send. They can put in a post-consultation message at the bottom, and then click Send. If we go back to the appointment diary, the appointment now says the item as well as a message. If you click the invoice button to the right of the item number, this item is automatically added to the invoice, as well as at the top, the wrap-up message. So the wrap-up is a great function we recommend practices use if you are not using it already. You may need to communicate with your patients in bulk. To do this, you can filter the patient list, which is a way of performing a patient search in Gentu. To do this, from the patient list, we click the Filters button. Over here, you can filter on a variety of items. I'm going to start by finding patients who are older than 65. Press Tab, and the list appears. You can see the filters being used at the top. Hit the cross to remove the filter. Next, I'm going to find patients who are older than 65 with hypertension as a diagnosis. I just type the word. I don't have to choose from my list. These patients then appear. I can search on other parameters if I wanted to. So I can search for all patients. And if I remove the previous filters I have. So click the drop down, and I'm going to choose appointments between a date range. You can see in the background, the applicable options do appear. And you may need to go into these patients for any reason. I click clear all, and when I go back to my filters, there are other filters you can use from the list, including, do they have any form of booking or no form of booking? Once you have filtered the patient list, as you can start to action should you need to. From here, you could click on the individual patient record to open up their record to action them individually. Instead, I'm going to click bulk SMS. This allows me to send an SMS to all these patients at once. I can also make a spreadsheet of these patients should I have any reason to for auditing purposes.